Good morning, everyone, and welcome to today's Oral Pathology Corner. I am your host, Dr. Stephen Zahm, and I want to thank you for joining me today. We'll jump right into today's topic, which is kind of a very visually hard pathology to describe, but it's something that is very important in the field of dentistry because it's often misinterpreted as a toothache. But that is something called trigeminal neuralgia, which is a health condition in which our trigeminal nerve, which is one of the major nerves of our bodies, is the main nerve that kind of branches and gives sensation, particularly the sensation of touch, to each side of our face. And, as with any nerve, if something starts to misfire, it's going to create a whole host of issues. And so with trigeminal neuralgia, it's a condition where those nerves are misfiring for some reason. Typically, it's associated with some kind of either trauma or compression to the nerves, which compression could be from any number of reasons. It could be from neighboring blood vessels or some kind of tumor or any other number of things that could cause compression on a nerve. But like any other pinched nerve, that causes misfiring of that nerve and creates the sensation of just, without experiencing it, hard to say, but what I've been told is one of the worst pains imaginable. Just kind of a burning, sharp pain on that side of the face. And it usually does only affect one side, but just terrible, terrible pain. And so naturally, with our mouths taking up a good portion of our face, a lot of times it's confused with a toothache. That toothache can cause pretty severe pain as well, and since it's in the region of the affected area of the nerve, it's easy to get those mixed up. So again, not something visually I can show you, but I think you get the general idea of what I'm talking about. And as far as how we can treat trigeminal neuralgia, that's not something your dentist would treat, but treatment can be a little bit complicated. It's a lot of times that compression on the nerve can be associated with other neurological disorders. So, of course, treating any other underlying neurological disorders would help, but a lot of times, bare minimum, some kind of medication is going to be necessary to kind of soothe that misfiring nerve. And even then, it's not a foolproof plan of action. The trigeminal nerve is a very, very large nerve, and so because of that, it's more difficult to treat, and it's harder for it to respond to medications. And so surgical intervention is a possible treatment as well. It's a very, very complicated surgery, and obviously, as with any neurosurgery, that runs the risk of complications like permanent numbness or damaging adjacent structures, any number of things. That's not to say that it's not warranted, but just it does come with its risks. So, but yeah, that's essentially the idea. Again, obviously, diagnosing is important because if we can rule out a toothache, then trigeminal neuralgia is something to consider, but there are any other number of things that could cause that burning sensation on the face as well. shingles would be one thing that comes to mind that could also be misconstrued. But with that being said, I want to thank you for joining me today, and sad to announce that today will be the last segment of the Oral Pathology Corner. I've just, over these last few years of making videos, I've kind of run out of topics that to use for this segment. The regular Tooth Teacher Tuesday will still continue as long as I can come up with topics for that. But yeah, as far as oral pathologies, obviously there's textbooks this thick with different pathologies, but we've covered a lot of the main ones over these past few years, and certainly the ones that are the most the more common and the more, I guess, interesting. So this will be the last episode of Oral Pathology Corner, but like I said, the regular program will continue on every week from here. So I want to thank all of those who have watched thus far, and I hope you'll join me for our regularly scheduled program next week. Thank you.